Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy Materia Medica series. Today's remedy is Rhus toxicodendron, which is prepared from the eastern poison oak plant. Also known as toxicodendron pubescens, it should not be confused with Rhus radicans, which is the taxonomic name for poison ivy. Both Rhus tox and Rhus radicans are members of the Anacardiaceae family. Since the two plants produce virtually identical symptom profiles, the fact that Dr. Constantine Herring lumped them together under the same heading in his very influential Guiding Symptoms is of minimal practical concern when it comes to the clinical use of this remedy. All right, let's talk about Rhus tox.
All right, so I'm going to begin this discussion by describing a general trend or theme that we often see in Rhus tox cases, which is a restlessness that comes from a feeling of stiffness. A certain part or parts of the body feel stiff, and the discomfort or pain created by this stiffness or rigidity makes it very difficult for the person to sit still, to lie still, or just to be still. In most cases, this restlessness is physical, but the same phenomenon can sometimes apply to the mental state too. In most cases, the stiffness is located in a muscle or muscles, or tendons or joints, but the feeling can also occur in some more unusual places, like the eyes or the tongue or the throat. And oftentimes, the problem or main complaint can be traced back to an event or a period of time when the person overexerted himself or overused the part that then subsequently became stiff or painful. Now, in the case of Rhus tox, the modalities are extremely important. So I'm going to raise the modalities to the top of the list and talk about them first before I discuss the mentals, generals, and so on. Okay, now, the Rhus tox symptom profile resembles that stereotypical image of rheumatic stiffness, whereby the afflicted person feels discomfort upon first getting going. He rises from his chair, and his arthritic knees, for example, are stiff and painful. His first few steps are slow and cautious, as if his knees are old and creaky. But with each successive step, they begin to gradually limber up, and pretty soon he's walking with little difficulty. That is, until he walks too much, beyond his capacity, at which point his knees begin to hurt again. This is when he must sit down to give his knees a rest. However, it's not long before his knees start to bother him again, even while he's sitting. But rather than getting up to walk again, he opts instead to simply change his position. He shifts in his chair. He crosses and uncrosses his legs. Each change of position brings temporary relief until he feels the need to shift again. Eventually, he feels compelled to rise from his seat yet again in order to walk off his pain and stiffness. Now, I've just described what I call the Rhus tox cycle of restlessness. The poor person is simply unable to rest for long in any one position. It's most often described as a feeling of stiffness, but patients can just as easily refer to it as soreness, tearing, or even a bruised or sprained feeling. The discomfort makes it nearly impossible to be still. Instead, he is restless and fidgety, frequently shifting and changing position. These are the patients who can't sit long during the initial interview. They ask if I mind if they stand and move around while talking to me. Now, using the example of low back pain and stiffness, let's translate this Rhus tox cycle of restlessness into the language of homeopathic modalities. While sitting in a chair, a woman's back starts to stiffen and bother her. She begins to feel worse while resting, and so she decides to get up. It's at this point that her back feels worse upon initial motion, and in this case, worse upon rising. She soon begins to feel better from the motion of standing and walking around. She does a variety of daily activities and still feels better from the continued motion. Eventually, at a certain point, her back starts to bother her again. This is when she begins to feel worse from overuse or worse from overexertion. She sits down again to rest, but this rest only brings temporary relief. She's tired and sore from the day's activities and doesn't want to get up again. She shifts in her chair and her back feels better from changing position. Frequent changes of position continue to bring brief periods of relief. She moves around in her chair, trying to stretch her back, and she finds that she feels better from stretching the muscles. But sooner or later, she must rise again from the chair to move around, and the vicious cycle repeats itself all over again. Now, Rhus tox also tends to be worse in the morning, and worse on rising from sitting, and worse on rising from lying. We can see how all three of these modalities are just extensions of the idea that Rhus is worse upon initial motion. Rhus tox is also generally worse in the evenings, and this is an extension of its tendency to be aggravated from overuse at the end of the day. After a busy day of restless activity, the Rhus type eventually reaches the point of having overextended herself. And the fact that stretching ameliorates can also be seen as an extension of the idea that Rhus tox is better from motion. One additional modality is an amelioration from lying on a hard surface. So we think of Rhus tox, for example, when a person with back pain wants to lie on the floor in order to get relief. Now, there are also some very important weather and temperature modalities associated with Rhus tox. Broadly speaking, Rhus is worse from cold and better from heat. It's also worse from dampness and better from dryness. So the worst possible combination is cold and damp or cold and wet. And the best weather conditions are warm and dry. Rhus tox is also aggravated by cloudy weather, foggy weather, and rainy weather. Of course, all three of these tend to be accompanied by cooler and damper conditions. It makes sense, therefore, that autumn would be the worst season for Rhus tox. Rhus is one of the main remedies for conditions that are aggravated by the approach of rain or the approach of a storm. We think of Rhus when a patient tells us that they know when a storm is coming because their old sports injury is beginning to feel sore and stiff. Additional Rhus tox modalities include an aggravation from cold applications, an amelioration from warm applications, and an aggravation from getting wet, especially getting the head or feet wet. And lastly, we often see a sensitivity to or an aggravation from open air or drafts of air. Now let's compare these modalities to the standard recommendations of allopathic medicine. Conventional medicine has conditioned the world to apply ice packs to acute injuries and heat to chronic injuries. While there is some wisdom in this, it nevertheless disregards the reality of individual differences. Yes, applying ice to an acute injury may help reduce bleeding and swelling, but it can also aggravate the problem for certain individuals, like the ones who are aggravated by cold, as is the case with those who need Rhus tox. Furthermore, this cookie-cutter approach to first aid can easily confuse the homeopathic prescriber. When a patient tells me that he's been applying ice to an injury, it can sometimes be difficult to discern whether the ice is actually helping the problem or whether it's being done because it's what the patient thinks will help the problem. And this can muddy the waters when it comes to choosing an effective remedy. Part of a homeopath's job is to teach patients to observe the differences between the reality of their own symptom patterns and what science tells them about their symptoms. All right, enough about that. Now let's move on to the Rhus tox generals. Okay, so generally speaking, stiffness is the one most common complaint of people who need Rhus tox. And Rhus tox has an affinity primarily for the muscles, tendons, and joints, in addition to the skin. It's also true that Rhus is a commonly indicated remedy for a wide variety of problems that cover almost all systems and organs. Rhus tox is almost always a chilly remedy, and as already noted, it is sensitive to cold temperatures and cold, damp weather and prefers warm, dry conditions. Rhus is generally restless and feels better while in motion and tends to be worse while at rest. In the case of Rhus tox, we raise these temperature and motion modalities up to the level of generals. In other words, we think of these modalities as generals because they often apply to the person as a whole rather than just to a single part, like a painful joint or a back injury. As an example, we can apply the very same modalities to a case of laryngitis. In such a case, hoarseness of the voice is worse after rest when first speaking, but then better as the voice limbers up, so to speak, and better as the person continues to speak until it eventually gets worse again after speaking too much or for too long. In terms of food and drink preferences, the most characteristic clue is a desire for cold milk. Some Rhus tox cases prefer cold drinks in general. Other preferences can include a desire for cheese, yogurt, sweets, ice cream, and oysters. Sometimes there's an aversion to meat. One last general is that Rhus symptoms are often left-sided, and in some cases the symptoms can progress from left to right. It's one of the main remedies for left shoulder pain, and it's also prominently listed for left-sided sciatica. Okay, before we discuss some Rhus tox physical conditions, let's talk about the mentals first. Although physical restlessness is a defining feature of Rhus tox, it's also true that restlessness can be a characteristic of the Rhus tox mindset. Rhus is mentally restless in the sense that it fits people who feel compelled to be active and on the go. It can be hard for them to relax or to even sit still. They keep themselves busy and they like it that way. This can be interpreted as another manifestation of the amelioration from motion modality. Sometimes the Rhus tox restlessness translates into a tendency to be hardworking, hurried, and impatient. Oftentimes, the restlessness is accompanied by anxiety, and the anxiety tends to have similar modalities. It's often worse at night while trying to rest in bed, and it can drive him out of bed, and it can drive him from place to place. The anxiety is ameliorated by pacing or walking, by walking in the open air, and by motion in general. Sometimes the anxiety can spill over into irritability, agitation, and involuntary causeless weeping. As it gets worse, the Rhus tox anxiety can stiffen into compulsivity. There may be a compulsive sense of responsibility. At its worst, it becomes rigid, manifesting as ritualistic behaviors, fixed ideas, or excessive religiosity. And Rhus tox is one of the most prominent remedies listed for superstitious thinking. The Rhus tox fears tend to reflect a similar kind of fixed, rigid, suspicious, or superstitious thinking. There can be a fear of evil, a fear of being injured, a fear of fire, a fear of being murdered, a fear of killing someone, and a fear that something bad is going to happen. The most characteristic Rhus fear is a fear of being poisoned. Rhus tox lists in repertories under fear of being poisoned, fear at night of being poisoned, delusion that he is about to be poisoned, delusion that he has been poisoned, and delusion that his medicine is poisoned. One final point regarding the mentals is that Rhus tox dreams tend to mirror its overall state of mind and the cause of much of its physical troubles, which is overexertion. It lists prominently under dreams of exertion, dreams of work, anxious dreams, restless dreams, dreams of fire, dreams of climbing, and dreams of the events of the day. In most cases, Rhus tox is prescribed on the basis of the physical symptoms and their modalities. But as you can see, when the mentals do come into play, they tend to reflect a similar theme of stiffness, restlessness, and overexertion. Okay, now, so once we understand the Rhus tox modalities, it becomes a lot easier to spot situations for which it is needed. Of course, it's commonly indicated for injuries involving muscles, tendons, and joints. And although Rhus tox is the number one remedy indicated when people complain of stiffness, it also fits conditions described by patients as feeling sore, bruised, tearing, and shooting. Rhus is a remedy for strains and sprains, and many will describe a feeling as if the injured part is sprained. It's frequently indicated for ankle, elbow, knee, shoulder, wrist, and hip sprains and injuries. In fact, if a condition involves muscle, tendon, or joint pain and stiffness, then Rhus tox may be the remedy of choice, especially when it's associated with the characteristic Rhus tox modalities. To emphasize this key point once again, the pain or stiffness is worse while trying to rest and better from motion. It is worse upon initial motion after rest, better with continued motion, and worse again from too much use. Since sitting or lying around causes them to stiffen up, they frequently change position or stretch the affected parts in order to get a bit of relief, and this is what makes them so restless. The pain and or stiffness is aggravated by cold and damp and ameliorated by all forms of warmth and dryness. We think of Rhus for conditions triggered by or associated with overuse, overexertion, excessive straining, or excessive lifting. It's a remedy for repetitive strain injuries like tennis elbow, golfer's elbow, or carpal tunnel syndrome from typing. Of course, Rhus is also very commonly indicated for neck and back injuries. It fits spinal injuries like whiplash, especially when the main complaint is neck or back stiffness that causes the person to constantly move and stretch. Recall that bryonia is the complementary opposite to Rhus. Bryonia fits those who feel better from having their necks immobilized by a brace after a whiplash injury because it's too painful to move the neck. Once bryonia works and the initial phase of acute neck pain improves, it's common to see a second phase during which the neck can now be moved but still feels stiff and sore. This is when Rhus tox becomes a useful follow-up prescription. Rhus is also a remedy for back pain, especially lumbar strains caused by repetitive bending and lifting. To be clear, Rhus tox is not just a remedy for acute injuries. It fits all kinds of chronic conditions that manifest in a similar manner with pains and stiffness that respond positively or negatively to the same modalities. Rhus is often needed in cases of arthritis, rheumatism, sciatica, especially left-sided sciatica, and chronic neck or back pain, even when it can't be traced back to an injury or to a period of overexertion. Now, naturally, the symptoms that we associate poison oak and poison ivy with most are itchy skin eruptions. Rhus tox fits a lot of different types of skin eruptions. Of course, the most common kind of eruptions are itchy blisters. And don't be confused by the terminology. Most homeopathic references refer to blisters as vesicles. Let's list some common skin conditions that involve itchy blisters. Of course, Rhus tox is one of the main remedies for chickenpox. It makes sense, therefore, that Rhus can also fit cases of shingles. Another condition that can manifest with blisters is herpes. Rhus can also be useful for post-herpetic itching and post-herpetic neuralgias. It also fits fever blisters that erupt in and around the mouth, as is often the case in impetigo. And we can't forget poison ivy itself. Sometimes the Rhus tox itch is accompanied by burning. The main itch modality is an amelioration from heat. Some like to run very hot water over their itchy hands, for example. They often say that they like it as hot as they can take it without burning themselves. And although Rhus tox can fit blisters that show up just about anywhere, it also fits a variety of non-vesicular eruptions too. This can include eczema, rashes, hives, psoriasis, and rosacea. It can fit eruptions located at the tip of the nose and cracks at the corners of the mouth. One peculiar keynote clue that points directly to Rhus tox is a triangular red patch at the tip of the tongue. And lastly, we think of Rhus tox when we see a combination of arthritic stiffness and itching, especially when an eruption is located near the involved joints. We also think of Rhus tox when a suppressed skin condition is followed by arthritic pain or stiffness near the site of the original eruption. Okay, now to be complete, I'm going to list a variety of additional conditions and clues that should alert us to the possibility of Rhus tox, beginning with restless leg syndrome. We also think of Rhus for a sore throat that is better from warm drinks. Enuresis, especially in boys. Restless sleep with tossing, turning, and frequent changes of position. TMJ syndrome, especially when it's left-sided, with stiffness and jaw cracking. Left-sided sciatica that is better from walking and motion. Parkinson's disease. Left-sided hemiplegia. Angina with pain and numbness extending to the left arm. Heart problems aggravated by overexertion. asthma alternating with skin eruptions. And one last example that demonstrates the typical Rhus modalities is vertigo. The Rhus tox vertigo is worse on rising in the morning, better from walking, and worse at rest while lying. Okay, now let's talk about remedy relationships. All right, so two very well-known complements to Rhus tox are calc carb and bryonia. Constitutional calc types often need Rhus in acute situations, and bryonia and Rhus are commonly needed in sequence for acute injuries. Remember that bryonia tends to be helpful in the earliest stages after an injury, when symptoms are worse from motion, while Rhus tox often follows later on when symptoms are better from motion. Remedies to compare to Rhus tox include arsenicum, which is similarly chilly, restless, anxious, and worse at night. The difference is that arsenicum is restless from anxiety, while Rhus is restless due to physical discomfort. Rhododendron fits arthritic complaints that are worse from cold, wet weather, worse before a rainstorm, better from warmth, and better from motion. Dulcamara also has stiffness and rheumatic complaints that are aggravated by cold, damp, and storms. Ruta is a common first aid remedy for tendon and joint injuries, fits repetitive strain injuries, and has pain and stiffness that is worse from cold than damp. Zincum metallicum is very restless, superstitious, fits neurologic conditions like restless leg syndrome and Parkinson's, and gets ailments from suppressed skin eruptions. Anacardium is a poison oak and poison ivy remedy and fits itching that is ameliorated by very hot water. Rhus venenata is similar to Rhus tox. It also fits itching that is better from very hot water. Kali bromatum is very anxious, has fears and delusions about being poisoned, has restless hands, and trouble sleeping at night. And lastly, lachesis also has fears and delusions about being poisoned, has left-sided symptoms that extend to the right, and is aggravated at night in bed. Okay, that's it for Rhus tox. If you like this presentation, please share and subscribe. I always welcome comments and questions too. Thanks for tuning in to the All Things Homeopathy channel, and until next time, may the vital force be with you.